Remember to subscribe, and don't forget to hit the bell icon to never miss an update from Maternity Hospital. For a couple who is trying to get pregnant, the 2-week wait can be filled with anxiety. Around 2 weeks, or 15 days past ovulation, you may be able to know whether or not you are pregnant. What is 15 DPO? If you are trying for a baby and your periods are regular, you will likely miss your period around 15 days past ovulation, DPO. For many women with a regular cycle, this is often the first and most reliable indication of pregnancy. However, it is important to remember that factors like stress or hormonal imbalances can also cause a delay. 15 days past ovulation symptoms. At 15 days past ovulation, the symptoms of an impending period and an early pregnancy can look very similar. To help tell them apart, here are some common 15 DPO symptoms that could indicate a pregnancy. 1. A missed period. As mentioned, if you have a regular cycle, your period is officially late at 15 DPO. This is a strong indicator of pregnancy. 2. Bleeding or spotting. You may notice light pink or brown spotting on your toilet paper or underwear. This could be implantation bleeding, which can occur when the fertilized egg attaches to the uterine lining. 3. Changes in breasts. Your breasts may become swollen, heavy, or tender to the touch. This is due to rising progesterone levels. The areolas, or the area around the nipples, may also appear darker than usual. 4. Cramping. You may experience mild cramping at this stage. Early pregnancy cramps are often described as a dull ache, or a pulling or tingling sensation, which is different from typical menstrual cramps. This can be caused by the uterus beginning to stretch. 5. Headaches. Increased levels of pregnancy hormones can lead to mild headaches, which are a common sign of early pregnancy. 6. Nausea. You may experience nausea, which is often called morning sickness but can happen at any time of day. This is a symptom that is more specific to pregnancy than to PMS. 7. Frequent urination. Your trips to the bathroom may increase. This happens due to hormonal changes and increased blood flow to your kidneys. 8. Exhaustion and fatigue. It is common to feel profound tiredness or fatigue. Your body is working hard to support a potential pregnancy, and rising progesterone levels contribute to this exhaustion. While fatigue can also be a PM symptom, pregnancy fatigue is often described as more intense. What does it mean when you get a negative result at 15 DPO and no period? If you take a home pregnancy test and get a negative result, but your period has not started, you should not immediately conclude that you are not pregnant. It is possible you ovulated later than you thought, and your body's HCG levels are not yet high enough for a home test to detect. If you do not get your period for a few more days, it is a good idea to take the test again. However, if you continue to get a negative result on a home pregnancy test and your period has not arrived, you should visit your healthcare provider. It is best to consult a doctor, who can confirm whether or not you are pregnant by conducting a blood test for a more accurate result. What does a faint line on a pregnancy test indicate at 15 days past ovulation? A faint positive line on a pregnancy test, in most cases, is due to low levels of the HCG hormone in the urine. If you take a test again after a few days, the line may become darker as HCG levels increase. However, in other cases, a faint line could be an evaporation line. An evaporation line can appear if the test is left to sit for longer than the duration mentioned on the packaging. If a faint line appears within the time specified by the manufacturer, there is a high chance that you are pregnant. If the line appears after the test has been sitting for a long time, it is likely just an evaporation line. The most reliable course of action is to get in touch with a doctor to get a blood test done for an accurate result.